Now we are live. All right. Good evening, everyone. Thank you for joining us today at the Health Show. Today we are talking about laboratory results. So I believe many of us here we have the cost to visit the lab to maybe do some diagnostic tests, do some scan. So we are going to discuss around that topic today. We have with us a lab scientist, Mrs. Omas, and we also have Choma with us to a discussant around this topic. So, my first question goes to Omas. I want you to tell us um, how are lab results carried out? Are there any standards? Is it that I can just wake up now, open a lab? How? Tell us about the lab. Like, let us know more about the lab.
Oh, okay. Thank you very much, Mr. Ezike. From your question, a lab is a place where we carry out diagnosis of a patient's condition. Now, not everyone can wake up and open a lab. We have the association. We have the Association of Medical Laboratories Scientists of Nigeria. Then we have Nigeria Institute of Science Laboratory Technologies. But for Medical Lab Association, they deal mostly with medical and diagnostic tests. That's what is done majorly in the lab. So if you are not a med lab scientist, you will find it very difficult to get to open a lab. Then number two, also there are also standards that are required in opening a lab. Your lab must be up to a certain standard before you can operate a lab. So when your lab does not operate up to certain standard, you end up generating results that are inaccurate and are fake. So that is all about a lab. Majorly
Okay.
in the lab
Okay. So
also, um we deal with various kinds of patient sample, be it from blood, from the patient's urine, the patient's stool, anything you can think about that has to do with a human body. That's what lab scientists work on majorly.
okay, you mentioned something very striking. You said if I want to open a lab because I'm not a lab scientist, do you say it is impossible or it is very hard?
It is impossible. It is impossible because they are regulatory
Okay.
bodies, and if you a layman just wake up and open a lab, when the regulatory bodies come, they will shut your lab. They may even charge you to court or even be arrested by the Nigeria police force for opening a lab without getting their badge, without belonging to their association.
Okay. So you must belong to the association before you create a lab.
Yeah, you must have not even belonging to an association. You must have gone through 5 years of training in school to get a background in various parts of the lab. There's a part that deals with blood, there's a part that deals with urine, chemistry tests, various kind of tests that lab scientists work on. So you must have gone through that 5 years first of all. Then you will now be inducted into the association. Then you are now certified to open a lab.
Okay. So you mean that all the labs that we see today are operated by professionals, lab scientists?
Yes, yes, they are operated by professionals.
Okay. So that brings me to our second guest, Mrs. Choma. Choma, have you ever visited a lab and you feel that the experience you got is not really professional?
Hi everyone, good evening. Yes, it happens from time to time. You visit some labs and then it looks like everyone is confused, clumsy, not knowing exactly what the doctor wants you to test for. And some other times you get professional service over. I have, truly, I have.
Okay, now the way it looks like now, it's as if maybe those professionals that registered these labs are not present as at the time you came, or maybe as Ms. Omas has explained, maybe they are actually quacks. So let me just ask the question straight. So Omas, do you think that there are quack laboratories around, or do you think that there is no proper regulation? Because I
Uh,
think me myself, I've also experienced a situation where I'll go to a lab and then the services are not really very professional, because if you have been 5 years in school, there's a way you interact with me that I will understand that this person is a graduate. But the way some labs do not even have, I don't think they have a graduate around their staff members. So what do you have to say about that?
Number one, I would say life happens. When you visit a lab and the lab scientist is not professional, is not calm, is not coordinated, does not communicate well to that patient. Number one, I will not just say they are quacks. Number one, I would
Okay.
say life happens. Okay, because for example, when I was working in the lab, there are times that the patients that come in a day, as in the pressure, I can attend up to, let's say, in the space of an hour, I can attend up to 10, 15 patients. And every each of them asking for, Madam, when will my test result be ready? Madam, when will my test result be ready? Especially during when we had antenatal days. The pregnant women I could attend to in 2 hours can be up to 20 patients. So number one, I would say
Wow.
life happens. Sometimes it's the pressure of the work. And number two, we all know what's the familiar phrase, village people. There are some people that come with their problems from home, maybe married couples, or they have one issue, one financial issue or the other. They can't set aside that problem when they come to the lab. I usually say, when in the time I was working in an hospital, I usually tell them, when you come to the gate of the hospital, throw away your problems, then attend to your work professionally. When you come out, then you can attend to your problems. So some of them may be having facing pressures from life. So that pressure made they decide to take it onto their patient. Number three, I also say patient attitudes. There are some patients that you attend to. Okay, let me give a practical example. There was a patient that wanted to attend to, and the patient came with a baby. And as normal custom, when you want to take sample from a baby, we don't allow the parents to be there because of their attitude. They may start is, Madam, why are you pricking my baby twice? Madam, abeg, do fast. All kind of statements. So we don't allow the parents to be there. So we explained to this man that, okay, sir, ma, you cannot be there. Wait outside. She agreed. The next thing that happened was the husband just opened the door and started shouting that we want to use his baby for human sacrifice. We want to collect the baby's blood. That he has watched African Magic. That he has seen what they usually do on movies. And that one created issue. We had to we had to practically tell the man to go with his baby. We don't need your money, just go. So imagine that kind of scenario. The man
Yeah.
acted and we acted, you understand? Then
Yeah.
also another fifth reason I can give is when you don't go for trainings regularly. Each of these
Yeah.
bodies, they have trainings you go for, and you are being taught on how to handle patients, how to have standard operating procedures to make sure that your test results are accurate, how to correlate with other lab scientists if you're having error in your results, things like that. So if you don't go for such training, you end up falling back instead of moving forward. So I will not say all the labs, the way they operate, they are quack. Although there is quack, we know in Nigeria, for every original there must be a fake, normal. So these are the reasons why you encounter some kind of issues when you go to a lab.
Okay. You mentioned something that there is quackery. I don't know. Let me ask. Choma, have you experienced any cases of wrong results in the lab, or maybe the doctor sends you to a lab and then give you a result, you went back to the hospital, the doctor is telling you that this lab result is not correct, something like that. Have you had that experience before?
For me, no, but I've heard people say stuff like that where they carry out same results, same tests in different labs, getting two different results. I've had
Okay.
people say it. But really, Omas, I would like to clarify something. Is there a scheme where people learn to be lab scientists, like through apprenticeship without going to school? Maybe they just come, learn, even if it is not approved by the um, professional bodies in charge. But does it really happen? Because I know that there's sometimes when you go to a lab, you'll be able to distinguish between a professional and someone that looks like is under training, something like that.
That's a good question. So, Elvas, I think you can respond to that.
Okay, come again, please.
Okay, I was asking if there is something like an apprenticeship
Mr. Ezekiel, can you come
scheme.
again?
Yeah.
Okay, Choma actually asked a question, so I believe she will have to answer that. Ask it again. So, Choma, can you please go over your questions again?
Ramos, can you hear me now?
I can hear you now. Yes, I can.
Okay, I wanted to know if there's something like a scheme where people are trained to be lab scientists without going through university training. More like they just come, they learn from a professional. After a while, they are discharged to go and work somewhere in a lab. Is there something like that with lab scientists?
No, there's nothing like that. Actually, some years back, if you had a background in science, in sciences, there was a 2 years training you had to undergo before becoming a lab scientist. But all those they scrapped, it has been scrapped. It has been scrapped. So you must go through 5 years training.
Okay. Okay. Now, I haven't answered that question, Omas. I have. Sorry, we are just bombarding you questions, but it's part of the interaction. I have.
It's
I want
okay.
to know why more than one lab we give two different results. Are they not using the same reagents, the same testing pattern? More than one lab. Sometimes three labs can give three different results. I've seen
Uh,
I've seen a friend who actually tested positive for HIV in one lab, the next lab negative, the other lab inconclusive. I think what was the reason? Yes, you understand. So that was three labs giving three different results for just one patient. So what do you think is responsible for this?
Number one, your reagent. There are some kind of times that you will notice that your reagent has issue. Number one, that one can alter your lab results. Then
Yeah.
number two, working temperature of your lab. Because before opening a lab, it is required that your lab has certain temperature. There are some tests that you need to carry out that needs to operate under certain temperatures. So when those tests are not done under certain temperature, it can alter your lab results. So
Okay.
three labs having three different results, especially HIV results, that's a big error. At times also it could also mean that the kit they use has expired. Also that can also alter it. So it's good that when you're working in a lab, you take note of your reagents, you take stock, know when they have expired, when to replace them. Then it's also good also to have a working relationship with other labs in order to compare your results also before giving out your results to a patient, especially HIV. The kind of HIV test you can do the test and ask the patient to come back maybe 2 hours later or 3 hours later. If you notice your reagent, your kit has issue, so you can send that particular sample to another lab just to correlate the result you are having. So
Okay.
that
I'm
can
sure. I'm
also
sure.
be an issue
I'm
too.
sure you are talking like this because you are quite diligent. There are some labs that they don't even care. You understand? They don't even care. They just, as far they have got, even if that positive is not correct, just say the person positive, and then that person can go kill himself if he wants to kill himself or he wants to just be depressed because of something like that. So I think this is one of my last questions I have before we see if there's any question in the comment section for our guests. Um,
Okay.
Now, in carrying out lab result and giving out the patients, giving the result to the patient, is there a way a patient can ensure Or is there a way patient can know that this lab result is original? For example, if I'm selling a drug to a patient, if I give the patient the drug, the
Mm.
patient can simply check the expiry date of the drug. Pharmacist, this drug that you're giving to me, so it has expired, oh, okay? Then sorry, ma, change
Okay.
it, or whatever is the case. But is there a way a patient can check what she's getting if this result is verified or is not verified? Because some lab results, especially these infection, STI, you just be seeing staphylococcus everywhere. Some you will just see different sensitivity tests. So how can you think, what is your advice to the patients that are listening? Like how can they ensure that these results, so that when they see it tomorrow, say, I heard somebody told me that if this result is like this, meaning that this result is not accurate. So what can they say?
Okay. Normal. Not a lab result is supposed to carry the seal of a scientist. So it means when the scientist has worked on it, it contains that seal. It will have the seal of the scientist to show that if the results have any issue, you can come to me because it's carrying my seal. It's just like when you buy vitamin C. Okay, let's say paracetamol. Sorry, we
Yeah,
have different products like Emzor. Emzor.
yeah,
Now, if I buy Emzor paracetamol and it has an issue,
yeah,
I will say, okay, it's from Emzor company that I'm having an issue
yeah.
with. Then number two, when you get a lab result, it is important that you take that result to a doctor. A doctor can authenticate the results and say if the result is original or fake. So there's no clear code boundaries for a patient to know if this result is original or
Okay,
fake. Ehen.
okay.
But
Yeah.
another thing also, if you have also done the test previous test, you can also compare. You can
Okay.
also compare. You can also go to another lab to repeat the test. For example, for this HIV, if you are giving a test and it's showing positive, you can decide to go to a bigger diagnostic lab to confirm that particular result. So those are the only ways you can know if a result is fake or is real.
Okay. All right. Thank you very much. Thank you. I think so far you mentioned the lab scientist seal, the seal of the lab scientist. Then the patient should try their best not to interpret their results by themselves. They should just go to the doctor with their results. The doctor can also authenticate their result. I think those are two good points that our listeners can grab from this session. So I don't know if Shoma have anything to say for our listeners before we wrap up, or anything to say to Omas before we wrap up for this session.
Thomas, thank you so much. I would like to know
You're
if
welcome.
there's a way of identifying a certified lab, or to know if it's the right place to do a test. Maybe there's a frame, maybe a documentation we need to look out for, and all of that. Maybe when you enter a lab, you should see this certification from so and so body. Is there something that we need to look out for to identify a good lab?
Yes, 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 very important. When you walk into a lab, you are supposed to see that certification, Medical Laboratory Scientists of Council of Nigeria. It's supposed to be in the person's lab. Person is supposed to hang it there. So number one, it must be there. Then number two, you can also depend on hearsay, because there are some certain labs that are known for the authenticity of their results. As in, everybody knows that if you go to this lab, they give good results. That also you can
Mm.
also use to know a good lab also. So those two you can use to authenticate a lab.
All right, thank you very much, Thomas. Thank you for having us.
You're welcome.
All right. Thank you very much. Thank you for your time. I appreciate, and to my viewers, I appreciate your time too. So far I have not seen any question in the comment section, so we'll call it a wrap up at this moment. So, must thank you. And just so you
Okay.
know, if you go to a laboratory, you have to ensure it is being a lab result is sealed by the lab scientists. Do not take a lab result that is not sealed. And then when you visit the labs, ensure you check for the what you call it now, the certificate or the license for them to be a laboratory. So you don't go to a place where after spending your money, you don't get value, and then you get a wrong result and you start treating with a wrong medication, which can also be another problem entirely. So thank you very much, everyone, and see you same time next week. Bye bye.